My Lords, I should first declare my position as Vice President of the LGA and the NALC, and I rise particularly to speak, and unfortunately we haven't heard from the Noble Lady Baroness Thornton yet, but I attach my name to Amendment 23 in her name, which is about consultation with local authorities, which is what so much of our debate in this group thus far has already addressed. And I think I want to particularly associate myself with the comments of the Noble Lord Lord Hunt and the Noble Lord Lord Davies. I think there has been a great rearrangement of the NHS that has happened entirely under the radar and is very deeply disturbing to those of us who are concerned about the risk of the Americanisation of our NHS and the takeover of private US healthcare for-profit companies. And I would just note of interest, I'm slightly surprised no one has mentioned it yet, the report in the Times this morning about the Health Secretary seeking to model NHS hospitals on academy schools. And when we look at the fact that that has been seen as a very large privatisation of our education system, and also the fact that we recently only found out entirely by accident that the Chancellor was giving days of his time to go and visit US healthcare companies in California, the runes are very disturbing. And one of the things that we need to defend against this, both the kind of incidents that the Noble Lord Lord Davies referred to, but also this restructuring by stealth, is we need local authority involvement, which is what the Noble Lady Baroness Thornton amendment seeks to ensure, at least in part. And I do just also want to comment very briefly on another amendment in the name of the Noble Lady Baroness Thornton, which is 44, about protecting the collective arrangements and conditions for staff, pay conditions and arrangements for staff. And I think that we have to look at that in the context of the fact of the survey out this week that showed 1 in 4 doctors say they're exhausted to the point of being impaired in their work. We have an exhausted, utterly worn down workforce. And we know also that we have nurses who are not paid enough, so they end up going to food banks to feed their families. And it's obviously a matter of justice that we at least protect and, in fact, improve the pay and conditions of healthcare workers. But more than that, this is very much an issue of health as well, because workers who are overworked, underpaid, simply are not able to deliver the quality of care that we would hope to provide. So this group of amendments, I very much hope that this will get some attention, because all of this has happened under the radar. There's been no public discussion of this, and it desperately needs to happen. So once again, it seems to fall to your Lordship's House to try and really get this on the agenda.
So, my Lords, I